Peripheral Neuropathy Causes. You are watching a production of GoodHealthTube.com. This video will for the most part be limited to the peripheral neuropathy causes. Before we get started, we'll remind ourselves that the peripheral nervous system is those group of nerves outside of the central nervous system. The central nervous system consists of the brain and spinal cord. Damage to nerves inside the central nervous system is central neuropathy. Although the peripheral nervous system ultimately connects with the central nervous system, the neuropathies are different even though they both involve nerve damage. Also, before we move on, we will quickly remind ourselves of the three types of peripheral neuropathy: sensory neuropathy, motor neuropathy, and autonomic neuropathy. You can find out more about these peripheral neuropathies by watching our other videos in our neuropathy playlist. A link will be in the description. Causes of peripheral neuropathy, disease and damage to the peripheral nervous system. Diabetes. Diabetes is the leading cause of peripheral neuropathy in the United States. This kind of neuropathy is often referred to as diabetic peripheral neuropathy, or simply, diabetic neuropathy. About 60 to 70% of people with diabetes have mild to severe forms of damage to sensory nerves, motor nerves, and autonomic nerves. The sensory neuropathy symptoms include numbness, tingling, or burning feet. Severe pain can sometimes result. Other symptoms include pain and muscle weakness on the trunk or pelvis. Some of the autonomic symptoms of peripheral neuropathy include abnormal heart rates, bowel or bladder function abnormalities, and problems with perspiration. Autonomic peripheral neuropathy affects nerves that regulate involuntary bodily systems such as bladder function and digestion. The way diabetes causes peripheral neuropathy is by having high blood sugar levels. Prolonged high blood sugar levels can cause damage to the tiny blood vessels, which in turn affect nerves. Diabetes can be diagnosed by simple blood tests. Physical injury. The most common cause of acquired single nerve injury, mononeuropathy, is physical trauma. Automobile accidents, falls, sports, and medical procedures can cause nerves to be stretched, crushed, or compressed. Even less severe injuries can cause severe nerve damage. Broken or dislocated bones can exert damaging pressure on adjacent nerves, and slipped discs between vertebrae can compress nerve fibers at the spinal cord's exit point. Sciatica, or pain from the sciatic nerve, is an example of neuropathy from slipped discs in the spinal cord. Prolonged pressure on a nerve, such as that exerted by a cast, or repetitive, forceful activities can cause ligaments or tendons to swell, thereby constricting thin nerve pathways. Ulnar neuropathy and carpal tunnel syndrome are common forms of neuropathy caused by compressed or entrapped nerves in the elbow or wrist respectively. Repetitive wrist motions can be a kind of trauma causing carpal tunnel syndrome. Having diabetes can contribute to the nerves being weakened from withstanding the stresses of daily life. Autoimmune disorders. Systemic, whole-body, autoimmune diseases, in which the immune system erroneously attacks several of the body's own tissues, can directly target nerves. Autoimmune disorders can also cause complications when surrounding body tissues compress nerves. Sjogren's syndrome, lupus, and rheumatoid arthritis are some systemic autoimmune diseases that cause neuropathic pain. Autoimmune diseases that attack nerves only are often triggered by recent infections. They can develop quickly or slowly, while others become chronic and fluctuate in severity. Damage to the motor fibers that go to the muscle includes visible weakness and muscle shrinking seen as in Guillain-Barré syndrome and chronic inflammatory demyelinating polyneuropathy. Multifocal motor neuropathy is a form of inflammatory neuropathy that affects motor nerves exclusively. In other autoimmune neuropathies, the small fibers are attacked, leaving people with unexplained chronic pain and autonomic symptoms. Circulatory problems. Vascular and other blood vessel disorders that reduce the oxygen supply to the peripheral nerves can cause damage to nerve tissue. Neuropathy can be caused and/or compounded by diabetes and smoking, which affect the health of blood vessels. Artery constriction due to high blood pressure or atherosclerosis, fatty deposits on the inside of blood vessel walls, can also cause peripheral neuropathy. Thickening and scarring of the blood vessel wall caused by vasculitis, intrinsic inflammation of the blood vessels, can impede blood flow and result in patchy nerve damage, also known as mononeuropathy multiplex or multifocal mononeuropathy. Vitamin deficiencies, drugs, and toxic exposures. Inadequate nutrition or vitamin intake, alcoholism, and exposure to toxins can cause nerve damage and neuropathy. Vitamin B12 deficiency and vitamin B6 excess are the most widely recognized vitamin-related causes. Chemotherapy drugs, which are drugs used to treat cancer, are known causes of peripheral neuropathy symptoms. This includes drugs such as vincristine, cisplatin, suramin, and docetaxel. Radiation can also cause peripheral neuropathy, but radiation-induced neuropathic pain usually manifests itself months or even years later. Other drugs with prolonged use such as the antibiotics nitrofurantoin, macrobid or macrodantin, and metronidazole, Flagyl, can cause peripheral neuropathy. Other infection-fighting drugs such as chloroquine and dapsone can also cause peripheral neuropathy. Seizure drugs such as carbamazepine, Tegretol, phenytoin, Dilantin, and phenobarbital have been known to cause peripheral neuropathy. Drugs used to treat HIV such as Xaret, Emtreva, Videx, and Truvada can cause neuropathic pain. And finally, certain heavy metals such as mercury, lead, and arsenic can be causes of peripheral neuropathy. These can be diagnosed with blood tests. Infections. Infections can cause neuropathy by attacking nerve tissues. Viruses such as varicella zoster virus, also known as the chickenpox virus, can cause shingles when it is reactivated later in life. When we get chickenpox, typically as a child, the virus never leaves our body. Usually after age 50, the virus can reactivate, causing intense nerve pain. Other viruses known to cause neuropathy include the West Nile virus, cytomegalovirus, and the herpes simplex virus. Infections with these viruses can involve sensory fibers, resulting in lightning-like pain attacks. Lyme disease, carried by tick bites, can cause a range of neuropathic symptoms, often within a few weeks after infection. HIV can cause extensive damage to both the central and peripheral nervous systems. An estimated 30% of HIV-positive individuals develop peripheral neuropathy sometime during their lifetime. Liver and kidney disease. Disorders of the liver and kidneys can lead to abnormally high levels of toxic substances in the blood, which can harm nerve tissue. Most dialysis patients with kidney failure develop varying degrees of peripheral neuropathy. 90% of dialysis patients are affected by peripheral neuropathy. Kidney-related peripheral neuropathy is also known as uremic neuropathy. Symptoms such as pain, loss of sensation, and weakness are typically functionally disabling for the patient. Liver disease has been associated with peripheral neuropathy, but the exact mechanism of cause and effect has not been elucidated. The predominant pattern of involvement was an axonal sensory motor polyneuropathy. Neuropathy was observed in both alcohol-related and non-alcohol-related cirrhosis patients. Hereditary motor sensory neuropathy. Hereditary neuropathies are a group of peripheral nerve disorders that can cause symptoms such as tingling, burning, weakness, and numbness. These nerve disorders are frequently caused by changes in the genes that are passed down from parents to offspring. There are various types of inherited neuropathies, each with its own unique cause and set of symptoms. Charcot-Marie tooth disease, CMT, is the most common form of inherited neuropathy. CMT results from genetic mutations that gradually weaken the nerves in the hands, arms, legs, and feet. People with CMT may have difficulty walking or running due to muscle weakness and sensory problems such as pain or tingling. The good news about CMT is that the majority of patients live normal lifespans. Bone marrow cancer and other bone marrow disorders. There is a condition in which the bone marrow makes too much protein. This is known as monoclonal gammopathy of undetermined significance. This condition is not cancer per se, but is a precancerous condition that can cause peripheral neuropathy. Other bone marrow cancers such as lymphoma and multiple myeloma can be associated with peripheral neuropathy. The common mechanisms of action involve the productions of proteins that stick to the peripheral nerves and cause nerve damage. Idiopathic neuropathy. Idiopathic peripheral neuropathy is a disorder in which sensory and motor nerves of the peripheral nervous system are affected without a discernible underlying cause. Frequently this is a diagnosis of exclusion, which means all other tests have come back negative or inconclusive. You can watch a dedicated video to idiopathic neuropathy in our neuropathy playlist, a link of which will be in the description. The enzyme. Before we recap this video, we want to notify you about a discovery of an enzyme that is involved in the development of peripheral neuropathy. This enzyme has important implications in the way neuropathy can be approached. A link in the description or the pinned comment is available to learn more. Now, let's recap the contents of this video. Peripheral neuropathy is disease or damage to the peripheral nerves which are outside of the brain and spinal cord. The causes of peripheral neuropathy and the associated nerve damage are several. Diabetes is the most common cause of peripheral neuropathy in most westernized countries. Elevated blood sugar can cause direct nerve tissue damage by affecting the small blood vessels. Physical injury can cause sciatica, single nerve compression in carpal tunnel syndrome, and ulnar nerve palsy in the elbow. Broken and bruised bones can also cause peripheral neuropathy. Autoimmune disorders such as lupus and rheumatoid arthritis can cause peripheral neuropathy. Circulatory problems from atherosclerosis and high blood pressure can contribute to peripheral neuropathy. Nutritional disorders including vitamin deficiencies can cause peripheral neuropathy. Drugs used to treat cancer, HIV, and seizure disorders can cause peripheral neuropathy. Heavy metals exposures can cause peripheral neuropathy. Infections such as shingles, HIV, other viruses, and Lyme's disease can cause peripheral neuropathy. Liver and kidney disease can be associated with and cause peripheral neuropathy. There are hereditary causes of peripheral neuropathy. Certain bone marrow conditions with their abnormal protein production can cause peripheral neuropathy. If no discernible cause has been found, then the peripheral neuropathy is known as idiopathic peripheral neuropathy. Keep in mind that the common pathway to these different causes is damage to the peripheral nerves. Symptoms of peripheral neuropathy including neuropathic pain from damage to the sensory nerves are elaborated on in further detail in our other useful videos in our neuropathy playlist. Finally, check out how the discovery of an enzyme involved in the development of peripheral neuropathy can have important implications in the approach to neuropathy. A link in the description or the pinned comment will be below. Please like, subscribe, and comment. Hit the notification bell to be notified when more videos become available. This video is not a substitute for consulting a physician. It is not intended as medical advice. It is intended solely for educational and informative purposes. Always consult a healthcare professional before beginning a new health plan. You have been watching a production of GoodHealthTube.com. Thanks for watching.